Today we have been blessed to hear Dr. Pitts discuss the importance of communication breakdown and how that can happen in the workplace. And I think it's so crucial because it's something that we can easily not appreciate to its fullest degree. So, what was the purpose of doing this, leading this discussion today?
Well, I think recently I've just seen a lot of patients come into our clinic with misinformation, but above all, terrible previous clinician interactions. And 9 times out of 10, it's communication breakdown. Mm-hmm. Sometimes it's just the other doctors aren't great people persons, but most of the time it was communication breakdown and how the information was relayed. One was a lady who was just in tears as she was coming in, nervous to meet with me. And I was like, typically I don't feel like I'm very intimidating, but she was just super nervous. And as we kind of continued on and talking, and obviously her BMI was a little bit elevated, so it was very difficult for her to have to be vulnerable again and know that a surgeon's going to come in and potentially talk about getting the weight down to make everything, be more successful as a result of surgery. And after talking, I kind of explained to her why we wanted the BMI down, and not that she was too fat for surgery, because that's what she was told. As she went and saw this other provider, he was like, "Sorry, you're just too fat. Come down when you've dropped 50 pounds," or whatever he said to her. And she, after we communicated and I explained, look, it's more about reducing your risks and we want a successful surgery. I can do the surgeries, but how's your outcome? And you want a good outcome, not just a surgery. And it flipped. Her mindset changed. And at the end, she just was in tears saying, I just was so nervous. And I was like, I could tell. Like, why were you so nervous? She's like, PTSD. I was kind of reliving all of that again. And it just broke my heart that happens so often, especially with our bigger BMI patients. But same thing with, I think, for smokers. We're trying to ask them to quit smoking. And we're like, gee, stop smoking. And they're like, you don't understand how difficult this is. And as clinicians, I think we sometimes miss that ability to provide good information and really explain what we're doing and why. And it's a big issue, I think, that's out there.
And sometimes I think we're so regimented. Mm-hmm. And we forget the compassion sense. Yep. So it's, you could ask a question in so many different ways, and a person's going to interpret it differently depending on how you ask. Yep. And I think it's interesting because I found it true also how patients communicate with different members of the medical team. So they might tell an MA one thing, I might come in and kind of get a slightly different version of it, and then the surgeon comes in and I think, well, I thought I knew everything, but clearly I didn't. So I think it happens all the way around, and it's important for us all to remember the importance of communication.
Yeah, and that's why I want to talk about the timeout. And I know that that's not the most interesting of material to discuss, is the timeout that we do before surgery, but really how the timeout gives us that ability to stop, to pause, to everybody listen, to all be engaged, and to reflect on what we're doing, why we're doing it, obviously the key elements of making sure that everything's safe. But for me, it always is a chance for me to step back and remember the patient's name, which sounds silly, but there's with how many surgeries we do and what we do, it's so important for us to step back and go, this isn't just a knee, or this isn't just a hip or a spine. This is Jane Doe, and she has this issue, and this is why we're doing it. And just kind of reminding ourselves, okay, yes, it is routine, but let's really communicate effectively so that we have a good outcome. Because I think in the OR, I like that that's been a routine thing that we do. The downside is it has become routine, but the upside is it does force us to really get a good communication on what we're doing, how we're doing it, and then afterwards when we do what's called a debrief, communicating what was done, and that carries on to all the aftercare as well.
And I love that. I think Dr. Edwards, John Edwards, he does a debriefing, and we've been able to reflect on the case that we just did and look for minute changes, big, whether they were big or small, but things that we can do just to make ourselves more efficient, make sure safety is priority. And I can only imagine patients knowing that or understanding that. This is why we ask simple questions like, what side are we doing? What are we doing? and it's to keep the patient safe, because they're our central focus. And I love that. And I loved what Carolyn said today with the never event. I mean, that's the purpose of all of this. We're trying to be effective in our communication skills, to avoid any type of wrongdoing, right? So I think it's super crucial to have this conversation, because as you said, we do it all the time. And so we can become complacent, and that's what we need to avoid. So I think having these conversations is so important amongst medical providers, helping patients understand why we're communicating this way. And I think in the end, it's hopefully going to make us a stronger community of providers.
Yeah, and Dr. Bowden had asked the question, hey, how many times does timeout actually catch something? And it's actually brings up a very good point of, it may not happen a ton, but that's the point, isn't it? The point is that we are doing this efficiently. That up to that point, there's been 59 checks and balances up to the timeout. The timeout should be, nothing caught. However, we're still all communicating. We're all on the same page. What a great example that for life. Right? For outside of the OR, outside of work, doing that with our family, checking every day, like doing a timeout and a debrief like I talked about. I love dinner time with my family because it's a chance to debrief. Okay, what was good in your day? What was bad? What can we do to help? What needs to be better? How can we make things more effective so you can do your homework and you can get to practice on time, or that I can, make sure when I'm home, hey, Dad, you were really kind of down today or busy. I'd love for you when you get home to be more focused. Hey, it's great feedback, right? Having those opportunities to kind of make sure we're avoiding that communication breakdown, that we're really being available.
I love that. And I love the idea of just being present. Whatever you're doing, make time, no distractions, and just be able to focus all your attention and energy towards what's important at that time. So I love that. Thank you so much, Dr. Pitts. You're always teaching us, and I appreciate it.